Hi guys, good morning. Happy Wednesday. Sorry, I'm crooked. um, we, I'm going to be talking with Kathleen this morning about mom care, essentially. I talked a little bit about this with another therapist not too long ago about healing from cesareans, but I think this morning we'll go a little bit deeper in caring for moms, even if it's not or MDs, because it's super important. And this is Kathleen's passion. So she's joining us now and we'll dive deeper on this discussion. So if you're a mom, I highly recommend listening. Even if you're not a mom but have friends that are moms, or you plan on being a mom in the future, or you have a mom, good morning. This conversation will be recommended for you. Good morning, Kathleen. Good to see you.
Good morning. How you doing?
Good. How are you?
I'm doing well, thanks.
Good.
Glad we
Okay,
could
Kathleen,
make
I'm
this
going to
happen.
read your. Go ahead.
No, I was saying I'm glad we can
Okay.
make this happen. Thanks for having me.
Sure. Thank you for. How's your baby?
She's
She
so
good?
good. She's 2 months old now. Yep, she survived her shots.
Oh boy. And that is a highly controversial topic itself.
All right.
Just to start things off.
Yeah.
I'm going to read your bio here, and then you can add in any gaps you would like to fill in. So Kathleen is a doctor of physical therapy specializing in pregnant and postpartum women. She's a graduate of the University of Florida in 2008, where she worked as a generalist in inpatient and outpatient setting for 10 years. 6 years ago, she specialized in I'll just say
Obstetric.
pregnant and postpartum women, because now I can't say that word, and served many women in the clinical setting. 1 year ago, she started a concierge home health company. She feels passionately that women should receive care in their home and not be burdened by making it one more appointment, which is true, especially with a baby, because leaving the house with a baby, it's a lot of work. Morning, Dawn. I know this is your passion too, so I'm glad you're here.
Yeah.
Please comment below and join in, because you have a ton of wealth of information yourself. Do you know Dawn Adelan? She's a physical therapist here in Encinitas, right across the street from my practice, actually.
Oh, okay.
She specializes in women's health. Where are you located, Kathleen?
In South Florida, like Fort Lauderdale area.
What area?
South Florida, Fort Lauderdale.
Oh, okay. My dad and brother in West Palm, and when I was in college,
we service West Palm Beach. Yep.
Oh, good to know. Okay, so if they need any help, I know who to refer to. Especially, well, probably not them, but females.
Yep.
She's also passionate about women being educated on prevention. She's always speaking at many childbirth classes and is on social media to try to help moms prevent the preventable, which is so true. I had a cesarean. I talked this a little bit a few weeks ago, but I had a cesarean and it wasn't recommended to do any type of physical therapy or anything following. And I think, and my surgeon, he was really great. My OB, he was an amazing, open-minded practitioner. It's not part of their normal practice or protocol to help, get moms help after this sort of thing. But, what do you really specialize in? What's your area of expertise?
So I do treat women for all different kinds of problems. Most of my caseload is currently pregnant women or postpartum. So that whole world is really where I specialize. But I also have women who are postmenopausal, women who have prolapse at any age, any of those conditions for sure. And then also just, neck pain, shoulder pain, anything like that. And especially if they're currently pregnant, they might have already gone to a local PT clinic and someone was like, I don't want to touch you with a 10-foot pole because you're pregnant. So
Right.
They want to send.
So what are you? what are you doing a lot of the times, or what are the challenges these moms to be and these moms are really encountering? Why are they seeking you out, or what do you usually focus on with them?
Yep. So it's like I said, any kind of musculoskeletal pain. So any of that neck pain, back pain,
Mhm.
down your leg pain. Also, gait dysfunction. I treat a lot because I have met many pregnant women who have fallen. I most
Mm,
recently had
that's
someone who
scary.
it's scary. I mean, it's scary for anybody to fall, but they're at a bigger risk
Hmm.
to fall because of their changes in their body, and then
Hmm.
they have more to lose when they fall. You know, there's two people who could get hurt
Hmm.
there. So I even had a patient who received an X-ray postpartum that I treated during pregnancy. She ended up having a sacral fracture when she fell, and we didn't
Oh,
know.
wow.
You don't get imaging when you're pregnant, so we just worked with
Mhm.
it. But yeah, it's serious. Like that's a problem.
Mhm.
So
Yeah.
pain, balance, and gait, and then dysfunction. So I've had patients who are pregnant who have no pain, but their knee is giving out every time they go from sit to
Mhm.
stand, or they're having severe bowel bladder dysfunction. And maybe in the third trimester, they can't get to the point where they're consistently dry, but they improve with therapy and with the techniques. So that's certainly, you know, worth coming to therapy for if you're going to have
Oh,
more
yeah.
control of that system of your body. So, and
Yeah.
then postpartum is anything from, like I said, the pain or dysfunction. So I do a lot of pelvic floor work. I do a lot of lumbopelvic work, core. A lot of patients will contact me for diastasis recti healing,
Mm.
prolapse, all of those conditions.
Okay. Yeah, pressure system there.
Yep.
I
Mm-hmm.
think if sometimes it's a misconception, whether it be a mom or anyone, but we have to wait till like the red flags, the warning bells are dinging before we actually
Yep.
seek help. And
Yeah.
I remember thinking when I was walking the dogs when I was pregnant, and I have a 60-pound lab mix and then like a 20-pound terrier mix. And so the two
Mm-hmm.
of them are 80 pounds or so. And I was
Wow.
walking them highly pregnant. And I remember thinking, because I had like a little trip, right? And I remember thinking, oh my goodness, if I go down, this is like a big deal. And no one ever taught, I've never, I knew this because as a PT, so I know all the like consequences. Like my mind started to go down that road. And
Right.
so then I was like much more cautious for the remaining like month and a half I had left of pregnancy. But I was like, no one ever talks about this. Like, like the risk of walking the dogs, 8 months
Yep.
pregnant.
Yeah. And it's funny you say that. I can't tell you how many ankle sprains I treated in the last, I think it's just 2 years from walking dogs. It's like a
Yeah.
dangerous activity.
It's the thing. I mean, even now that I'm not pregnant, I walk the dogs like every day, and
Right.
they're still like the same poundage, and
Sure.
it's just that squirrel or whatever can like set them off, and then
Yep.
so
And there you
core and
go.
holding your ground and
Yep.
boundaries is like it's all in
Yep.
the physical world when you're walking the dogs right there.
Absolutely.
Um,
Yeah. That's too funny.
so, Kathleen, what does wellness mean to you personally?
So for me, I mean, initially it was all about movement and staying physically active. And now that I get older and I've had my second child, I understand how wellness is, it's so holistic. You know, it's about how you move your body. It's about where your mind is at, how much stress and negativity you allow to exist in your world, how you manage that stress. And just basics like understanding how important it is to sleep well every night, how important it is to keep friends active in your life. So to me, when I saw that question, I was like, it's just the whole person. It's every
Everything.
aspect of what you put in and what you put out, if that makes sense.
Yeah. Yeah, I agree with that fully. It's a lovely way to put it.
Yeah.
Comment below if you're watching. What does wellness mean to you? I think um, each of us, it's so individualized and personalized, but at the same time, there's definitely overlap person to person because, like Kathleen was saying,
Sure.
it is so all encompassing. Um, so, when you're working with these moms to be and these moms, what's the biggest tip you find yourself giving them that has the most lasting impact?
Yep. So one of the things that I try to preach so often is to stay active during your pregnancy, because that can prevent a lot of conditions that I see, and to speak up as soon as you notice that something is hurting or that something is not working. Because when I get a woman in front of me who this is unfortunately 70% of what I end up evaluating, you're in your third trimester, you're 10 out of 10 pain, very difficult to walk, and they're crying. Like the emotions and the fears have already escalated, and it's a lot to work through. It's a lot. From a physical perspective, it's harder to work through, and from that like cognitive, emotional perspective, you have so much to backtrack from. So speak up as soon as you're like, oh, I've noticed that my back really hurts every time I stand up, or I look at myself in the mirror and I'm walking really weird. Speak up, say something.
And if the person that you do talk to, because again, I've heard time and time again that someone has mentioned pain down the legs, numbness in the hand, sciatica, SI issue, and they've told their OB, and their OB says, oh, you just have to wait till pregnancy is over and it'll go away. Yep. And I think there's things that that PTs we can help with during this process. You don't have to suffer for 10 months or 5 months, however much time is left in your pregnancy. And so if who you speak to, you don't get that reaction or the action that you need, speak to someone else, or comment below, or message me or Kathleen, because we can hook you up even if you're not in San Diego or South Florida. We're in a network of PTs that we can hook you up with and find someone in your area. Please don't suffer. I find that so often.
Yes. And I would say too, if you have that practitioner, sorry, I was just going to say, if you have that practitioner who says nothing you can do, let's educate that practitioner. So if it's your OB or your midwife or whoever is telling you, oh, that's pregnancy, come back and say, actually, I happen to know there's a women's health PT who says she can help with that. Do you mind writing me a prescription, or do you mind if I go? So I'm a big proponent of
that's important too. Yeah, that's a huge step. Yeah, exactly. Because then we're spreading the awareness and more people know. It's huge.
Right.
Thank you for bringing that up. Well, how do you work this holistic wellness into your business model?
Yep. So with my company, it's a concierge home health. So I go to the house, and typically when women want this service, unfortunately, is because they are either really early postpartum, like it's very difficult for them to get out of the house, or physically. Their pain is so high, or their walking is so poor that getting out of the house is a burden. So they home, right? So that's sort of like a emergency, if you will. Let's fix this problem. So that's 1 or 2 visits to where they're feeling better. We've done the manual work that we need to do to get them where they can walk or they can take care of their baby. Then I strongly recommend, let's continue to work together. Even though you're feeling better, even though your pain has largely resolved, let's continue to work together to get you physically to a place where you can have maximum function. I don't just want you to be pain-free for the next 10 minutes. I want your body to be set up for success so you can continue to get stronger and then go to the gym or start playing volleyball, whatever it is you want to do. But you need to set yourself up.
Lift the baby as the baby gets heavier with all the car seats and paraphernalia. So do you continue to go to their house at that point, or do they come to you?
So I continue to go to their house for sure. And that's, again, just so convenient. And it sets, again, in another way, sets them up for success, because it's so easy to cancel, like, oh, it's raining, or I just put my baby down to sleep. I don't want to wake her up and put her in the car. I'm coming. If you're home and awake and alive, we're going to do therapy.
So lucky.
We're going to make this happen.
Yeah, that's great.
So it keeps them accountable.
As a side note for your own body, because I find this is part of the reason why I stopped going to people's homes, is how do you take care of yourself lugging that table around, the massage table?
Right, that's a good point. I actually don't use one. I use whatever they have in their house. Yeah, which I mean, I will say to your point, it is a little bit harder for me to do all of my work in a kneeling position because I'm typically on my knees
Right.
at their house and they're on the floor.
Yeah.
Or if
Okay.
we work on the bed, then I can usually sit. But yeah, I don't take a table because of exactly what you said. And actually, I found out I was pregnant like 2 months into my company. So I was like, well, there goes that. I'm not carrying a table, you know?
Yeah, right.
So
That's
yeah,
just not possible. Good for
right. So
you.
we managed. Yeah.
Yeah, you just make it work. Um, as you know, a business owner, what's the biggest challenge that you've had to overcome?
So one of the biggest issues I have is something that we sort of touched on, and it's getting the higher level practitioners to understand the importance of our profession and how we can help their patients. And I mean, I've met with so many OBs. I think they're wonderful people. They truly care about their patients. You know, I want them to see that I'm not just selling them and I'm not just looking for referrals, but I'm truly here as a resource. Like, please use me if your patients are suffering or if they're not functioning well, and I'll team up with you and we'll get this patient as well as they can be. So that hurdle, I feel like it's getting better, but that has been one of the biggest struggles with my company, is to get them to understand truly who I am and what my intentions are.
Mm-hmm. Yeah, I really felt that. Like I heard of that, but I really felt that when I was going through my own pregnancy, because I felt like some of my visits, and again, my OB was really, really good, and he was very, very open-minded. But a lot of times I felt like I was educating on all that we did in my own visits to check on my baby. But you know, I was like, I guess I'm here. I might as well educate.
Yeah, absolutely.
But yeah.
Good for you.
How do you incorporate wellness? How do you bring some of these practices into your own life, especially now that you're a mom with a 2-month? This is your second child, correct?
Yes. Yeah. My first
so
one's
with
older.
2 kids, your own business.
Yeah.
Okay. How old's your first one?
He's 6.5.
It's still young.
Oh yeah. He's
well,
still my baby for sure.
How do you bring all these wellness tips and philosophies into your life as a mom and as a business owner?
Yeah, so one thing I have started to do is to teach wellness classes. So to actually be there with these women, like I'm starting a 4th trimester fitness class in the community, and that helps me to be physically present in that exercising environment and to perform activities that I do. Like I'm in my 4th trimester right now. Because when I started my company and found out I was pregnant, we also had just bought a home. So I did let my wellness go, like it was put on the back burner. So now I'm trying to bring that forward. And realistically, if I don't like make myself have that commitment once or twice a week to teach these classes, then I can see it going on the back burner again. So I'm gonna commit to it for 8 weeks. Every Tuesday, we're all gonna meet, all the new moms, and we're gonna stretch and exercise and do what we can to prevent all those things from happening.
Yeah. Can you explain, because some people might not know what the 4th trimester is. I think there is a little bit more awareness about it, but still, can you give a little bit more details about what that actually is?
Sure. So basically, it's the first 3 months after your baby is born. And typically, it refers to the fact that they're so little and sleeping a lot and just nursing and sleeping and nursing and sleeping. So it sets the expectation that that baby is still sort of in that pseudo womb situation. It also encourages mom to be in that relaxing, not working, you know, just bonding with the baby. And so for me, just having gone through this, I understand why my patients used to call me at like 2 or 3 weeks postpartum and be like, can I go to a yoga class? And I'd say, no, like don't go to a yoga class. But now I understand why, because you're sitting so much and you're sore and achy. So your body yearns to do something. They just don't know exactly what. So that's what this class is going to be, to educate, like, okay, these are the postures you should be in. These are some easy, gentle stretches you can do. This is how you can engage your core and reconnect with it without overloading it, because you're still healing. So it's like just that for anyone who's well, it's not like a PT visit, because if you need medical intervention, you deserve your own individual assessment. But it's for women who are well and just want to know, how can I move? How can I stay connected to my body during this 4th trimester?
Yeah, I love that. So if you're not in South Florida and you don't have access to someone like Kathleen to know how to re re-welcome yourself back into the world of movement and fitness and yoga, that sort of thing, you can reach out to Kathleen, you reach out to me, reach out to a PT in the area, even if they don't specialize in women's health, because they can get you hooked up with someone that can give you that information on how to get started again, especially if you've had a cesarean, right? So you can be mindful in how you move and have a little softness and gentleness with yourself as you get accustomed to, in a way, this new body that you have. Because even now, you know, my daughter's 3, my body is a little bit different than it was prior to pregnancy. My yoga practice is a little bit different than before, and not a good or bad way, in just an evolution different type of way. And I have to respect how it is now compared to how it was like in my early 30s or 20s or something like that.
Right.
So super important to start to move, but mindfully, I think. So how do you bring some of these wellness tips into your own life other than practicing with your class on Tuesdays? Like in your day to day?
Yeah, I've been working on my breathing. And I remember when this became a thing in women's health PT, and I was like, what is this? Why am I teaching breathing to these women? And now, after years of doing this, I catch myself, like when I get stressed out, when my baby is crying, or when I haven't had a lot of sleep, I catch myself holding my breath or breathing really shallow, like it doesn't, you know, I barely expand my lungs. So that has been something that I've been working on, and it makes such a difference. It seems so small and basic. It makes a difference on how I feel physically, mentally. It calms me. So, I mean, that is such a huge tip, I think.
It is a huge tip. I talk about that. In fact, I just led a mini retreat on Sunday, and it was 4 hours, and we spent a good portion of it talking about the breath. And it feels so subtle in the moment, but the consistency of doing something subtle each day or most days leads to bigger changes and bigger impacts. So Kathleen, what are some parting words of wisdom you'd like to share with everyone?
So my biggest thing is to speak up for yourself and make sure, if you, like you said, if you say something to your practitioner, something doesn't feel right, and the person you're speaking to doesn't acknowledge that or action with that, then keep going. Like, don't be settling with what you're hearing if it's not sitting well with you. And use your resources. Use your resources. If your friend's sister is a PT, call her. Use her and get online, get on your social media and ask, like, speak up for yourself, because I think that's so important. In 10 years, I never want to hear the story again. Oh, 5 months ago, I started having this problem, and now today I'm finally talking to you. I don't want to hear that story anymore. Or 5 years ago.
Yeah.
You know?
Right. Yeah, and I get, you know, social media gets a bad rap sometimes for many reasons, but this is one really positive thing that social media can help with, because there is that recommendation button on Facebook now, and you can, I mean, we're all human, we all have questions, we can never know everything at one time, so just posting that question out there, hey, I need a recommendation for this, and you will get responses. Great. So Kathleen, when we sign off here, can you leave your contact information below so people know how to get a hold of you if they're in Florida or if they do have a question? So Kathleen will leave her information below. And if you're interested in joining a like-minded community, I have the Ignite Wellness Facebook group where we carry on conversations similar to these in a group setting with other like-minded thinkers. I'll leave that link below. You can join. And thank you so much, Kathleen, for your time this morning. Congratulations on your baby.
Thank you.
Thanks. I look forward to seeing pictures on social media of growth.
Yeah.
Very good. Okay, well, have a great day. Thank you so much, everyone. Thank you, Kathleen. And we'll leave all the contact information below. Okay, great. Bye.
Thanks, Kathleen. Bye.
Yep. Bye.